Hello, this is Reverend Dr. Anthusa Helena, owner, developer of Sollite for healing and conscious awakening. Sollite offers integrative medicine training programs as well as private sessions. For more details, log on to www.sollite.com. So today I'm starting a 3-part series on self-care tools. And this will be part 1. Now, what's unique about this series is we are actually taking 2 months each of the integrative medicine training programs and modalities that are used in private sessions. And we are giving you a unique modality to cover those first 2 months of the series of training. And then part 2 will be the 3rd and 4th modalities. And part 3 will be the 5th and 6th modalities. What's also unique about this series is they're interrelatable. They're very simple and easy to use. And you will see as it progresses that the similar sounds and techniques for frequency and vibrational shifts on all levels of your being, physical, mental, emotional, spiritual, energetic, are covered and incorporated in the utilization of just one of these techniques. They will intertwine and be interwoven with all the modalities. So again, we are always under some sort of stress. And these simple self-care tools will help you alleviate or calm down and come back to your neutral space of being aligned and centered and calming yourself from whatever incident that might have triggered you to be in a modality of stress response that happens in our nervous systems and in our brains, communicates to all parts of our body. So the other unique factor of this 3-part series is that once you're in that situation, you can immediately take any one of these 3 tools and utilize them for a minute, 2 minutes, 5 minutes, 15, 20, 30, whatever time you have allotted in between whatever is happening next in your life, and it will calm you down and bring you back to center. So part 1 series is going to be covering color and light therapy and awareness in the brain. The first 2 modalities covered in the Practitioner training program. Now, these are foundational modalities. They're our makeup of our being. Color and light is, we are energetic beings. Everything is energy. And as we come into a more solid or seemingly appearing solid state, we still have this foundation of energy in the form of frequency, vibration, relative to color and light. Our cells speak to each other through light called photons. And then the second month of the training program is awareness in the brain, which covers all the mechanisms in our structure of our brain that hold our belief systems, our conditioned habits and patterns, our emotions, and our traumas, traumatic events. And if you're living life, you will not avoid any kind of traumatic event that happens throughout your lifetime. So you will see as I progress to go over this simple self-care technique with you, how it is affecting these two areas, our foundational part of ourselves. So let me bring up the slide for the training today. And basically here we have two sounds we're using, ill and ha. Now, ill, when you make that IL sound, you place your tongue at the roof of your mouth when pronouncing the ill, and you slightly arch your back, your standing position. So you tilt your head back with slightly bent knees. Now, you don't want to not lock your knees, but if you're arching slightly in your spine backwards, you also don't want to have straightened, locked knees, and you don't want them fully bent. So it's just a slight. And then as you come forward, the second part is ha, which is actually the sound for the heart center. And so we focus our attention when we exhale the breath with the sound of ha in the center of our heart. Now we bend slightly forward at the waist with soft, straightened knees. You never want to really lock your knees. For people that are hypermobile, it can injure the muscular structure, the tendons and ligaments behind the knees. So you can do this sitting if you're at the office. It's just what happens when you're doing it standing, and I apologize, I'm not showing you that during this demonstration today, is that your fluid in your spinal column is a semi-closed pumping system, cerebral spinal fluid. And as we arch backward with our head and our back, we're closing that off. We're giving constriction to the fluid flow by making a compression or a contracted effort of arching in the spine. We use the ill and we touch the roof of our mouth with our tongue because then you're getting straight at the roof of the mouth to those important areas of the brain structure in awareness in the brain that hold the emotions, the traumatic events, the belief systems, conditioned habits that we have acquired through life. And oftentimes also through genetic coding of our ancestry and culture, environment, as well as mass collective consciousness. So you want to stimulate that part of the brain. So as you bend forward and exhale with the ha, it's actually a releasing mechanism to help release and transform the stress and whatever emotion is coming up at that time. The ha is the sound for the heart, and the heart is known to be the emperor or the empress that controls everything in our whole being. It is our knowing center of our place where we also connect all parts of our being into the soul and spiritual realms. So as you're doing the movement of tilting backward and then bending forward, remembering that fluid, when we were just energy and hadn't come back and down into physical form as of yet, our nervous system was really like guitar strings. It was made up of energy that created sounds. and also had a frequency and vibration that came in the form of light. And with that various form of light came different colors and hues and shades, which is where our word human comes from. We are man that is made up of different hues, shades, colors, light, sound, frequencies, vibration. As we come more into a solid physical form, then it's not so much of a frequency of light that's traveling through our spine, but it's now more solidified network of our nervous system that connects with our brain, our computer in our head, and the brain gives the signals through the nervous system that travels down the spine, outward into all parts of our being, giving the message and messages that we need to have to just survive and also respond correctly in life. So I hope this is helpful, the explanation. If you wanted to incorporate a specific color, you can, and you don't have to. But as you think of ill at the roof of your mouth and you're thinking that you're inhaling when you're doing ill, and the exhale, ha, is the release. But with ill, and again, you're going to that midbrain area, and some of you that know yoga, that would be your third eye. And in color and light therapy, we would associate that with indigo, a deeper color blue, in between blue and purple or violet shades. When we exhale forward and thinking of the center of our heart with the sound ha, the heart color in yoga, medical qigong, and many other modalities I utilize is the color green. Green is a neutral color, but it's also a very standard healing color. It's also the color of our planet, Mother Earth, which is known to be the emerald planet, emerald green. You don't have to think about those colors, but if you wanted to, you can. It's an option. Sometimes when you're just doing this exercise to give yourself some maintenance to release a thought or a situation, emotion that might have occurred, not just necessarily to calm yourself in a moment of a crisis or an alarm, but just at other leisure times when you want to meditate or contemplate. You can use longer periods of time utilizing this self-care technique, which will heal, but also bring awakening or awareness to your consciousness. So if you're dealing with an emotion that's been bothering you all week for some reason, maybe anger or fear, and you have 20 minutes to 40 minutes to an hour, as long as you want, you can just think about what's triggering that emotion, go into this exercise, il, ha, and unfold, see what happens, see what comes up, see what releases. Usually you get some images, some thoughts, some feelings, of course, that pictures that might show themselves, and even sometimes even a heightened sense of that emotion or that thought energy pattern. And it usually increases before it totally dismantles and releases. So that's a different exercise for when you have time and you're working on a particular circumstance. But remember, what's good about these self-care techniques is that you can use them quickly within a minute to 5 minutes in between clients, in between whatever you're doing, errands, or working on the computer for a lecture, or whatever your life is like, handling your family, dealing with stay-at-home children, etc. During these times. You can just give yourself that quick respite of a minute to 5 minutes, which will bring you right back into a more neutral, calm, stress, elevated, free state, freer stress level. All right, so I just want to show you this briefly, that is without standing, and then you can enjoy and practice it on your own. Excuse me, do you get a drink of water? So remember, il, ha, 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 il, ha. So, hope you enjoyed that and that you utilize it. Give it a try, see how it works for you. And in about a month or so, I will be doing the part 2 series of these self-care modalities. And we will be covering cranial sacral therapy, which is the physical portion of the practitioner training, and medical qigong, which is the energetic portion of the modalities used in private sessions and in the trainings. Have a wonderful day. Enjoy the self-care technique. Stay safe and well. And thank you for your time, the opportunity for me to share with you today. Stay blessed.